Khaleequr Rahman. Let me get in Khaleequr Rahman. Khaleequr Rahman, the state government is bankrupt. We all know the discourse surrounding the guarantees where, all the government money has gone there. There's nothing in the coffers. Now, this has been a debate for some time. But the point being made over here is this. What is the motivation for doctors, to be working if they're not even receiving their salaries for 3 months? What is the kind of healthcare that people in Bengaluru are going to receive? Khaleequr Rahman.
Yeah, Madhav, good evening, and to all my co-panelists. In fact, I just heard what Mr. Gundu Rawat said, and also the BBMP chief has said. In fact, the Congress government has always been committed to the cause of the healthcare of the people of the country and of the states, whichever it is in the governance today. And with the very noble intention, the Congress has in fact set up the Namma Clinics. And when these clinics were set up, in fact, when we were trying to invite the application for the doctors' recruitment, and there was very, very poor response. But in spite of that, because since we were so wanted to go ahead with this, and because I'm coming to the subject. Let me give you a little background of this. Have a little patience. Have patience for about 30 seconds. No. People need, see, the people who are, you may be knowing about it. You may be knowing about the background, but the people who are watching this show also should know about the background. They should not just go on here and say what is being said here, actually. So that,
giving back. What is the hearsay here, sir? What is the hearsay? What is the hearsay, Khaleequr Rahman? Tell us.
No, see, so, and what
doctors are saying, staff are saying we are not receiving our salaries. Is that hearsay?
No, see, the BBMP chief has very clearly said that there were probably some attendance issues because of that.
Sir, which salary cycle issues affect the salary being dispersed for 3 months? Explain that to us. No, Mr. Khaleequr Rahman, this is what the BBMP chief is saying. Are you endorsing those views?
Yeah.
And tell me logically, how can a salary cycle issue impact 3 months of salaries? Please be logical.
That is the reason, because it is now up to the BBMP chief that he has to in fact put everything in order and make sure if the salaries are really...
No, what are you saying? You're saying these doctors did not work for 3 months? You're saying the staff did not work for 3 months? What are you saying, sir?
I'm not saying
Where is the question of attendance here? Where does that come in? And aren't you insulting the service of all of these hardworking people, common citizens of Bengaluru?
Madhav, why are you trying to put the words in the mouth which I'm not saying?
No, you're taking at face value the explanation coming in from the BBMP chief, who has no explanation. He is saying salary cycle issues are responsible for 3 months of salary delays. Really? Are we that dense now?
He's a responsible officer, and we in fact have to take him on the face value.
But we have to take him at face value. Anurag Naidu.
We have to.
Anurag Naidu, he is a responsible officer. We have to take the statement of the BBMP official at face value. Please respond to what's being stated by Khaleequr Rahman.
Yeah, I think it's made a good point, Madhav. I think we should compare the salary of the driver of the BBMP commissioner and how many months of delay that he has paid to his driver for driving his car, his chauffeur, and his servants should be compared to the people who are working as a frontline healthcare workers for the last mile delivery of the poor and the underprivileged people in Bengaluru. Let's have this comparison. How many legislators, MLAs, and ministers have got this deferred salaries, and are they okay about it? How many IAS officers, bureaucrats have enjoyed deferred salary by 3 months? Please do a comparison, because you cannot do a comparison because there is a union who will come up to your doorstep and say, hey, gentlemen, I have not received your salary, and you're going to pay them all the dues, bonuses, you know, what else? I mean, there is also, this is something that I always say, areas, interest on areas, everything will come, because then you have an IS association, then you have an MLA association, then you have minister association. What about this last mile healthcare workers? Show some empathy, sir. Show some empathy while talking. When you say that you do not receive a good response when you call for an application, that's when you have to increase the salary. That's when you have to make the workplace great. That's when you have to think about how you can really welcome better applications. That was a slap on the face if people are not turning up. That means there is something wrong with the advertisement in the first place itself. There are fundamentals to be corrected. Nobody is saying you don't roll out welfare schemes. All we have been bragging in the last few years, 2-3 years, we've been having the same debate, Madhav, that while you roll out freebie schemes, have your economic model sorted out. This is a perfect example of financial mismanagement. Dinesh Gundu Rao sir has no answer. Commissioner has no clear answer. That means it is a financial mismanagement. When you don't have your fundamentals sorted, what makes you think that you can go out and roll out 65,000 crore for the people and put your
the fundamentals are not clear. The fundamentals are not clear, and there is very clear and gross financial mismanagement. That is the word coming in from both Anurag Naidu and GS Prashant.